Dr. Michele, I see you got it going. You're on mute.
Good morning, everyone. It's nice to be here. I'm Dr. Michele Sewell-Ross. I'm originally from Jamaica, and I grew up most of the time in Brooklyn. And then I migrated to the Atlanta area after going to school in DC, in Connecticut, where I went to college at Wesleyan, and then I went to medical school at Howard University. So my practice currently is in Decatur, Georgia, and I practice internal medicine, pediatrics with some integrative medicine.
Do you know Madam Vice President?
Not personally.
Okay, all right, because she's a Howard too.
Yeah, she went to undergrad.
Yeah. Dr. Rachel out there saving many lives internationally. Introduce yourself real quickly.
Good morning, everyone, or is it good afternoon already? I am Dr. Rachel Salomonsen. I am an epidemiologist, and I've been doing global health actually for the past 20 years. And that came to an abrupt stop in terms of traveling in 2020. I'm very happy to be here as part of the panel. We've been following COVID very closely, so I look forward to having a dialogue about it. Thanks.
Awesome. Last but not least, another person that's in the front line, saving workers in the hospital. Dr. Darren Naugles, please introduce yourself. You're on mute, Darren.
Hello, everybody. Happy Mother's Day to all the mothers out there. I'm so excited and thank you. And it's been an honor to speak on this panelist with all these wonderful speakers. My name is Darren Naugles. I'm an emergency medicine physician. I've been an emergency medicine physician for 20 years. I am from Oklahoma City, but I call Atlanta my home. I went to undergrad college here in Atlanta, Clark Atlanta University, the good CAU. Also went to my medical school at Boston University and did my residency at Howard University in emergency medicine and trauma. Along with being an emergency medicine physician, I also own a wellness center that kind of focuses on integrated and functional medicine. I think that's the new area of medicine that needs to be addressed because if we get down to the core root of these diseases, we can really change people's lifestyle in that way. So thank you again for having me on board.
Okay, thanks, Dr. Darren. All right, guys, you ready? Audience, remember, you may go ahead and type in any questions that you have for a specific doctor, or if it's a general question, that is fine. And as they get around to it, they will answer questions. But I'm going to kick things off as the moderator right now. Dr. Michele, exactly what is COVID and how do people catch it?
Well, COVID is a virus, and it's the SARS virus, and it has been with us for a while. It has caused previous respiratory infections, but this particular one, they're thinking it came out of Wuhan. I guess, they're still looking at all of that, but it basically causes a severe respiratory infection and a lot more things, as we have all come to know. Basically, it's transmitted by respiratory and by surfaces, touching surfaces. So the best way to avoid it is by wearing a mask to control the respiratory secretions, and also to wash your hands, usually for about 20 seconds. And if you're going to use sanitizer, you should use at least a sanitizer that's 60% alcohol. Also, limiting the touching of your face, your eyes, your mouth, your nose also helps to limit the exposure.
Okay.
And wiping down frequently touched surfaces also helps to avoid the infection.
So, Dr. Michele, I know I'm not the only one who wipes down their mail from the mailbox or the groceries that you come in. So is that a contagious point for people, or we can just live our lives and not worry about that? Let me make it personal. Dr. Michelle, do you wipe down your mail or your groceries?
I think in the beginning I did, not so much the mail, but the groceries. But at this point, I don't, to be quite honest with you. But there is a small argument to be made for doing that, maybe, but it's really probably the risk of getting the virus that way is very, very small. The biggest issue is the spread by touching frequently touched areas and also by respiratory. So those are the areas that we really can at this point focus on.
Okay, all right. Final question for you for this round, Dr. Michelle. How long if someone contracts COVID, how long will they start showing symptoms, and when do they become contagious?
Usually it's about 2 to 14 days after exposure that you can develop symptoms, and usually you're contagious about 48 hours prior to the onset of symptoms. But the usual time after contact is 4 to 5 days for you to start having symptoms.
All right, thank you. I was going to go to Dr. Darren, but I will go around to Dr. Kelly. I don't know if you're back. We'll come back to you at the last part, Dr. Kelly.
Okay.
So, Dr. Rachel? Dr. Rachel? Oh, there you are. Okay. All right. So we're talking, Dr. Rachel, about grocery bags and opening mail, right? But we were told that the virus can be passed through contact. Can it also be passed through the air and the ventilation?
Okay, well, that's a really good question. And I think that, new information is coming out that says that the virus is likely more aerosol than anything else. And although we have spent so much time wiping down surfaces, the CDC has now said that there has not been a case documented where they've gotten it from surfaces. That in fact, most people who have gotten COVID-19 has been because they were in close contact, face to face, with someone else who had COVID, or they were in an area where there had been people who were infected and they left it in the air for them to breathe. So I'm not sure if it's so much that it can be passed through ventilation. In theory, it can, obviously, because when you speak, when you just by breathing, speaking, laughing, coughing, sneezing, we're letting out aerosols, and those aerosols are picked up and are circulated.
Okay.
But when you think about getting it through aerosol, then what you need to be thinking about is diluting the amount that you might become exposed to. So that's the role of ventilation. Having good airflow in your environment becomes increasingly important.
Okay. So what about people who are ready to travel and get out there? What about hotel rooms? Should people be concerned about the ventilation system and from one room to another if someone has COVID in the room above you or beside you? How does that work?
If you go with the idea that what we need to do is dilute the air, then you need to be thinking about the concentration of people, say, in that hotel room. So if it's a hotel room that's packed with like tons and tons of people, and the hotel itself is not exchanging air with outside, if they're really air controlled and they're just circulating, if the air is just recirculating inside, then yes, that's a risk. Most of us don't know what the hotel ventilation system is like when we go.
So just to give our audience a takeaway, right? Would you suggest a purchase of any of those air purifiers that they're selling? I don't know where the Home Depot or wherever they're selling those, though you can plug it in. I know when I go to my dentist appointment, they have a big room purifier.
At this time, I would say that's a really good idea. I should mention, I think Dr. Michelle mentioned Dr. Sewell-Ross mentioned that COVID is similar to SARS. It's just the new variation of SARS, and SARS itself was passed through ventilation, and there's documentation of that happening in Hong Kong. But again, it was about concentration of people.
Okay.
So I do think like an having a air purifier would be helpful. Opening
Okay.
your windows,
Okay.
windows, you know,
Okay.
getting a fan going, just get the air moving. I think that's very helpful.
All right, great. So my final question to you in this round, Dr. Rachel, because we're talking about the diluting of the virus in certain limited number spaces. So is that what makes being outdoors okay versus going indoors to a restaurant and eating?
Yes. I personally have not worn a mask when I'm walking my dog, for example.
Okay.
Because I live in a suburb and I'm not running into people. And I think the important thing with COVID is that we have to use common sense. You know, it's taken such a mental toll on people, and we need to learn how to live given the fact that this virus is out there. So yeah, so when you're in a situation where there's a lot of airflow, you're less worried. It's not that you're not worried, but you're less worried than when you're in an environment where it's a crowded situation. Or
all right, so I said last one, that was not quite accurate. Face shields. I have seen people wearing face shields with no mask. Tell me about. Okay. All right. Well, thank you, Dr. Rachel. We will move to our next doctor. Dr. Darren, you're back, right?
Hello.
I would like to cover testing with you before we go into therapeutics. What are the FDA-approved COVID tests? How are they different? And how would our audience know which test would be right for them?
So the test, so let's kind of talk about FDA approved versus EUA. Out of all the tests, all of the tests have not been FDA approved, but they've been applied to EUA. EUA is actually a emergency use authorization, and it's basically the FDA set up a team or a program. It's called the COVID Treatment Acceleration Program, in which the FDA accelerates the use or the testing of certain tests. So all of the tests have been EUA approved, but not FDA approved. Okay. So the types of tests that are offered are, one, the PCR test, which is the nasal swab. It's the most sensitive test. This is the test that really tests you for its sensitivity, meaning that they have very few false negatives. You also have what we call an antibody test, which basically tests you if you've had an infection in the past. And then the last test is the antigen test, which also tests you whether you're infected. But one of the things about the antigen test, it's specific, so you're going to have a lot of false negative results. So if any test were to be the most important test to take, which would give you less false positives, would be the nasal PCR test, which these tests, it's a nasal swab.
Okay, all right. So what about just providing some value to our audience here? I've heard of the rapid test. Is that something, where can they get that? And is that a reliable test that people can take, and then maybe they can go out to events, like the Lisa Nicole sipping shops or something like that? Is that a good test to take, and where can they get it?
You can get the rapid test is usually the rapid antigen test, and it is reliable. It's a reliable test, and you can get it done at any clinic. We do the rapid test at our wellness spa, but I think it is reliable. And a lot of times, if you come back with, say, if you're symptomatic and you have a test that's negative, then you should go and receive what we call a PCR test, just to make sure that that negative test was not a false negative. Because again, if you're symptomatic and you think you have COVID, antigen test is good, but if you come back false negative, you should proceed with the PCR swab test.
Okay, so so for our audience, it's a good enough rapid test that can be used. And in terms of traveling, is that the test that the airlines are doing for people who are not vaccinated?
Yes, the rapid antigen test.
Okay. All right. And last one for you on tests, antibody tests. How should a person determine whether or not they want to take the COVID test or an antibody test, especially if they've had no symptoms or knowledge of having had COVID?
Well, in the beginning, we were, a lot of times people wanted to know if they were infected in the past. So a lot of times people went to go take the antibody test. It also was told in the beginning and also continued to encourage people to take antibody tests, because if you test positive for the antibodies, you can donate your plasma. And we still need plasma in treatment of people with serious conditions. So the antibody test is still important, but I think the most important tests are usually the PCR and the antigen, because it really tests whether if you've been infected or whether if you have a current infection.
Okay, that's good to know. So we're going to encourage all our audience members to get tested with the antibody test, right? So that they could maybe help other people with developing vaccines, right? Okay, that is fantastic. And are the antibody tests more leaning towards false positive or false negative, or is it stabilized now? Can people trust the antibody test results?
Well, with the antibody test, they test for two different antibodies, the IgM and the IgG. The IgM are the antibody. Those are the two most abundant antibodies that our body produces. Those are the ones we focus on. The IgM antibody usually starts to be produced in our body 3 weeks after the infection. So sometimes people may get over the infection and they take antibody tests and they still test negative for antibodies. It doesn't mean that you didn't have the infection, that your body doesn't going to gain immunity. It just means that your body hasn't started producing the antibodies. So the IgM antibodies usually start producing at 3 weeks, and you can usually start to taper off at about 2 to 3 months. The most important antibody is the IgG, because that's the antibody that really gives you more prolonged immunity, up to 9 and even sometimes 12 months of immunity. And that antibody begins to surface in our bodies around 3 to 4 months. So just because you test negative for those antibodies does not mean that you were not infected, or that it does not mean that your body won't potentially develop immunity. You have to give your body time to produce certain antibodies, and certain antibodies don't show up at certain periods of time in your blood.
But if you tested positive, that means you definitely had it. Yes. You just don't know how long you've had it. And okay, all right, fantastic. Thank you, Dr. Darren. Dr. Kelly, are you ready? You're on a new Wi-Fi system?
Changed your Wi-Fi system. My husband came to the rescue.
All right, so guess what? Vaccines. That's where we started, and that's what we all want to know, okay? I will skip over the approved vaccines because I think a lot of people may know what those are. I think the bigger question is, why is it important for each person to get vaccine? Why is that important for them? And why does it matter if they got vaccinated? Why would they care if the person next to them or people next to them or surrounding them have not gotten vaccinated? And we can address that in school also.
Yes. So it's a lot of questions all in one. I'm going to make it very simple. For many people, the vaccines means freedom, us getting back to normal, us having, building up the immunity that we need, so that if we're exposed to the coronavirus, COVID-19, we now have the immunity already in place so that we don't become symptomatic and actually get the disease. It means that as more of us get vaccinated, as more of us are immune to the virus, then we can get back to doing the things that we want to get back to doing, which is being together with people, being with our families, vacationing, and doing the things that we want to do in terms of even our economy opening back up. So just like all infectious diseases, we need a way to be able to fight it. And the way we fight this particular infectious disease, just like most viruses, is to have a vaccine or to build some sort of immunity to the virus. That'd be how I would put how it can help us all.
All right, so I got personal with the other fellow angel, so I'm going to get a little personal with you. I believe the FDA is on the verge of approving, whether for emergency use or FDA, having children to age 12 to maybe 17 begin to get vaccinated on the hope that school will be reopened in the fall. So I know you have two little ones, awesome ones. Are you going to let your young say their ages, and are you going to let them get the vaccines?
That's a great question. We just had this conversation as parents and then actually with our kids. So our children are 13 and 14 years old. I want them to be a part of the conversation. They know that in general, I believe that the vaccine is important for us all to have, that I believe that it's safe. I believe that some of the concerns that people have about it getting in their DNA and changing their DNA, all of those things have been disproven. And so for my husband and I, we definitely were on the front lines of getting the vaccine, have very few symptoms. We can talk about that in general, but we let them know that we believe that it's safe for them to have. We also looked at their risk. I am very much in favor of kids who choose to be back in school, to be back in school. And I want that environment to be as safe as possible. So as a family, we'll make that decision, but we are leaning towards them being vaccinated.
Okay. Let's follow the science, right? So good. All right. So since we're on children, Doc, for parents or grandparents who have been vaccinated and the vaccine has not been approved for children younger than, say, age 12, how safe is it for them to be around the younger kids, like really kids, and how concerned should they be?
So for an adult I think what you're asking, Charmaine, is for an adult who's been vaccinated, how safe is it for them to be around someone who's not vaccinated? So I'm going to tell you right now, the CDC is saying that if you are vaccinated, you can be in an open environment without a mask. You can be with other people who are vaccinated, as many as you want, and even in an enclosed environment. And you can be with an unvaccinated group of family members, one family. So it shouldn't necessarily be I'm vaccinated and I'm with 5 different family units and they're all unvaccinated, because as I believe it was Dr. Solomon said, it's all about the numbers, right? So how many people potentially at risk can potentially be spreading that virus in the environment. So if you are vaccinated, the recommendation is you can be unmasked in a closed environment with at least one other family.
All right, let's end your segment, Dr. Kelly, with the J&J vaccine. People are terrified about it. What say Dr. Kelly Jackson-King?
Well, right now, I would say whatever vaccine is most available to you is what's recommended, okay? I would also say the benefit of the J&J is it's one shot. So if you're terrified of vaccines and you're not going to be able to go for 2 shots, there's a benefit there. The risk of this rare condition called TTS is very small. They're estimating it to be about 7 in 1 million. That's the estimate. So the risk of the virus and catching the infection and being ill is much greater than the risk of this condition called TTS. It stands for thrombosis and thrombocytopenia.
Okay.
So again, it's a pros and cons. In medicine, we're always doing pros and cons. The pros will still outweigh the cons. But if you have an option, would I choose an option that may not have that risk? Then yes, I would.
Okay. All right. Well, thank you, Dr. Kelly. That concludes your portion, Dr. Kelly. Dr. Michele, final question for you. Would you advise someone who has had COVID, knows they've had COVID, mild symptoms of COVID, maybe a little one-day ache, chill or something, to go and perform labs work like CBC, CMP, or any other type of diagnostic testing to see if there are inflammation that was caused to their liver, their kidney, their heart, or around the brain? just because they had it mildly? Should they do that? And I will say that question is for me, it's personal, because my youngest 18-year-old son, who's in college, got a mild case of COVID. He was later quarantined, but months later, when we had to do some insurance blood work on him, his CMP, the liver numbers were 3 times higher than normal. So then we had to do an ultrasound, and the ultrasound at his kidney was like a different color or something. And then I've heard people, I know Ivna will speak to this, people get tested for other different reasons, EKGs or stuff, and their heart shows information, and they were walking around asymptomatic, and some of them didn't even know they had COVID. So what is your recommendation for people who at least know they've had COVID and may have had it mild?
Well, right now, I don't think there's any direct recommendation for people to go out and get routine testing, especially the ones that are asymptomatic and have not had any particular symptoms during the infection or after. The whole thing is still really evolving, because they're even looking at blood tests now to help to see if they can decrease the number of false negatives, in terms of, people who may be asymptomatic and come out with a negative test. And
okay,
but as far as down the road, usually those recommendations are usually held for people who are currently symptomatic, but that may change, as we get deep. Everything is always unfolding.
Okay, so hopefully I heard you, and you are the medical doctor, so you're saying there's no need right now for people to get those type of diagnostic tests. However, if there anyone that's like a mom like me or anything like that, whose child has had a mild one, I'm not a medical doctor, but if you would like to find out if there were any side effects from having COVID, I would just recommend going to your family doctor for an annual CBC CMP thing, which is very simple and easy. So I hope that's a good takeaway for someone else.
So one of the things that, people could do is, just go for a
annual
physical or routine checkup, and just see if anything came out of
awesome.
that.
There you go. Listen to the doctor, guys. All right, that's the end of your wrap session, Dr. Michele. Dr. Darren, let's talk about therapeutics. Someone is feeling ill. First, how can you tell our audience when they should come to the hospital versus when they should just stay home and maybe take some fever, some Advil or whatever you take? What are the signs what is the fever level that you will tell them, come into the hospital?
So why don't we start with the patients who are known positive for COVID? So the patients who go to a minute clinic and they test positive for COVID, should they go immediately to the emergency department or should they go to their primary care doctor? I don't think it's necessary for everybody who tests positive for COVID to go to the emergency department or go to their primary care. I think the important thing that they should know is to quarantine, self-isolate, and kind of do the things that we tell everybody if you're testing positive for COVID. I think that if you do test positive for COVID, you should call your primary care doctor and let them know. We have people who come to the emergency department and say, I tested positive and I just wanted to make sure I was okay. And I said, well, how do you feel? Well, I feel okay. I was like, well, then I wouldn't tell them that they probably shouldn't have came to the emergency department, but I would reassure them and kind of give them instructions on when to come back to the emergency department. So some of the things that we tell people when to come into the emergency department and when to avoid the emergency department is, one, if you're positive for COVID and you're developing shortness of breath, you should definitely come to the emergency department, because that is probably a criteria for admission into the hospital or criteria that the COVID has started to spread in their lungs. The other thing is people who are having chest pain. Anybody who has chest pain with COVID, one, we want to make sure they don't have an overwhelming pneumonia. And second, we want to make sure they don't have what we call a pulmonary embolism. Again, people who are positive for COVID are at increased risk of a pulmonary embolism, or what we call a clotting disorder. So that's one of the symptoms. Severe weakness and dizziness. If you're passing out or you feel like you want to pass out, could be the signs of dehydration. And again, COVID is a multi-organ dysfunction disease. So people who become dehydrated, it may result in kidney failure.
Okay.
Okay.
Okay, great. All right.
Go ahead.
No, I would like you to finish. I was going to tell you were muted a little bit. Go ahead and finish.
Okay. So another thing, chest pain, shortness of breath, severe dizziness, severe weakness. If you're immunocompromised and you have a fever, these are the patients who we consider that they should come seek some type of medical help. One, they're immunocompromised, they have a fever. We want to make sure that their infection isn't leading to what we call sepsis, which is an overwhelming infection that kind of overwhelms the body. But anybody who's a normal, healthy person who has a fever, they should just, Tylenol or Motrin. And if their fever is not breaking after using Tylenol or Motrin, then they can consider coming into the emergency department.
Okay, wonderful. All right, so now they're in, okay? What type of I won't even use approved, but because I know that there were cocktails being given out to different type of people just to save their lives. But what is available in terms of therapeutics? Should our audience try to remember any name of therapeutics that you're going to give to them so that they can be well informed in case they are rushed to the hospital? And where are we with getting all those therapeutics approved? So
there are certain therapeutics that we use in the hospital, even whether it's the emergency medicine setting in the ER versus in the inpatient. Let's talk about the medications that have been FDA approved and those that have a EUA. The only medication that's been FDA approved is a remdesivir. That is an antiviral medication. What it does is it prevents the replication of the virus. So it prevents the virus from multiplying in your body. And that's how you basically slow the virus and kill the virus, by reducing its ability to replicate. So you have that, an antiviral. The other three medications that have been EUA approved are monoclonal antibody test, which is specific anti-SARS-CoV monoclonal antibody test. We also have some immunomodulators, and these are basically drugs that can reduce our body's inflammatory response. Because in COVID, we know that some patients' immune systems go into what we call overdrive. And we've heard of that term, cytokine storm.
Yeah.
So we have to understand that inflammation is a healthy process that our body goes through when we are sick. But when that inflammatory response goes unchecked and unbalanced, and it begins to get overdrive, and that's when you get into some organ dysfunction. So cytokines. So there are medications that have been EUA approved for what we call immunomodule that reduce the inflammation. One is Actimir, and the other one is Ambulance. Those are some medications that we can use. Okay. Some other therapeutic measures that we can use is basically plasma therapy, that patients who donate their plasma, they have antibodies, and we can give that to patients. Let's break it down. What patients should receive antibodies, what patients should receive the other medications. So in an outpatient setting, when patients are discharged from the emergency department, we can offer them the monoclonal antibody therapy. And these are patients who come in, they test positive for COVID, and we discharge them. And usually at Northside Hospital, we are really good about getting these patients within 24 hours to our infusion center to get an antibody therapy. So there's recommendations. Not everybody it's not indicated for everybody to get antibody therapy. Usually it's people who have comorbid conditions such as coronary. People who are 65 and over automatically are approved of the antibody therapy. People who are 55 and older who have comorbid conditions, meaning hypertension, coronary artery disease, diabetes, they are approved of getting the antibody therapy. Anybody with a BMI of greater than 35. The BMI is basically your body mass index. So people who have large BMIs, they also approve of getting the antibody therapy. So that's on an outpatient. And if you are admitted to the hospital and you require oxygen, it is not wise or it is not indicated giving antibody therapy. They say that people actually do worse when they're giving antibody therapy, when they're admitted and actually need to require oxygen. So there's other forms of therapy that we offer people with inpatient therapy. One is we do the antiviral medication, which is remdesivir. We also add that with steroids. We also use the immunomodulators. Patients should only require steroids only if they're admitted to the hospital, or only if they're admitted to the hospital requiring oxygen. A lot of our triggers as a practitioner or a physician is that we always want to put our patients on steroids who have inflammation, who have viral infection, but it's been proven that steroids usually makes things worse when people don't really need steroids, such as those who are on, who don't require oxygen and who don't require hospitalization.
Thank you, Dr. Darren. Since you were talking about ventilation, this is going to be your final question. Okay. For people who were on ventilation and had maybe some damage to their lungs, will their lungs fully 100% recover?
See, so one of the things, since this virus is new and we still don't have the data suggesting which patients will develop long-term lung abnormalities or long-term pulmonary function abnormalities, it's hard to say, but we know that it is out there and that people are developing some chronic complications with lungs. It's more likely with those patients who did come into the hospital and who require large supplemental oxygen or who are ventilated. But again, there's no, we don't really know what percent and what are some indications that people would have chronic lung disease. So I think some people will develop full function of their lung capacity.
Okay, that's good news. All right, audience, there is hope. Angels are giving you hope. Thanks, Dr. Darren Naugles. We are all set with you. Dr. Rachel, last but not least, we're going to give you a final 2 questions, all right? Okay? This one is going to be herd immunity. And will the U.S. ever achieve it? And doctor, please give me the non-doctor short answer. We want to kind of wrap this segment. So I just want to talk about herd immunity. Do you see the US ever achieving it? And if they do not get to that number that Dr. Fauci wants us to get to, what does that mean for us in the US, especially for those who've already gotten vaccinated?
Right. Okay. So I'll try to be brief as you suggested.
Contact tracing epidemiologist.
Yes, I'm not sure that herd immunity is absolutely necessary, actually. This is because it's not so much whether or not you get the virus, it's what it can do to you. We've never had herd immunity with the flu. We get it every year, we handle our business, we go on with our lives, right? And already, one of the things that the vaccine is doing is that it's not keeping you from getting COVID, but it's protecting you to a large extent from becoming severely ill. So if we can get to a point where, because of our natural immunity, which some people just naturally have, because coronavirus the current COVID is one of a series of a bunch of other coronaviruses, including the one of them that causes a common cold. So they're finding that some people have some T-cell memory, and one of the theories is that it's because they were exposed to some part of it in some way before. And then there are some other theories as well. But if we can get to a point where most people who get COVID are not symptomatic, it's not relevant whether or not we have herd immunity. Do I think we're going to get herd immunity? I would say at this present time, probably not, because of the cultural and political, because of the political situation, the cultural situations that we have here in the U.S. But it doesn't mean that we won't get control over this virus. So that's how I would answer that.
All right. So what I'm hearing is from herd immunity that we may not get to that magical number, right? But if we don't, the people who are vaccinated will have better protection from severe illnesses and hospitalizations than the people who are not vaccinated may still get those side effects, liver, kidney, heart, brain problems, hospital, can't breathe, those type of things. So that's what the world will look like. The vaccinated people will be protected, and the non-vaccinated people will get sick and or go to the hospital.
Unfortunately, it's not as clear cut.
Okay.
Right? Because we also have variants coming out, and there's new data that shows that people who are vaccinated can still get COVID. That's why you still have to be on guard. That's why you should still be wearing your face mask. That's why you should still be concerned about the group, how many other people are around you.
Yeah.
So I and I think that's one of the things that is hard for me to hear as an epidemiologist. And people think, oh, I get the vaccine and then I'm off and I can do, everything. I understand. Even I want to do that, right? Even I personally, that's what I want to do too. It's our human impulse. But we need to understand that could expose us to risk that we could have prevented otherwise.
We got it.
One more thing I want to say. I'm sorry. I know you're trying to end.
No. Yeah, I'm trying to wrap.
A lot of the severity, of course, has to do with your underlying biology and your pre-existing conditions and stuff, but it also has to do with viral dose, right? So they are finding out that people who get a lot of the virus inside their system or they have a fast replicating virus are going to get sicker. So that's why it's important to wear a mask, because then even if you're exposed to the virus, you get less of it in your system. Your body has more of a chance to fight it. So just want to say that.
Thanks, Dr. Rachel. Tip for everyone listening: continue to wear your mask, whether you're vaccinated or not vaccinated. I'm going to wear my mask for 2 years because I've not caught a cold. I've not had bad allergies, and I don't know what else I have caught. So I am a mask believer. Let's wrap it up, Dr. Rachel, with something very cute and funny. You wear your mask, you go indoor dining. How the heck do you eat with the mask? Do you take it off, put it on? Do you take it totally off? Like, what to do? Let's end there.
Right. So I have 2 small children, and one day in the middle of the pandemic, my children, it's been hard on them, us not being able to go eat and do all that stuff. So we went to eat, and I was a total nervous wreck because obviously you have to take your mask off when you eat. But what I will say is that it is spring. We have summer ahead of us.
Okay.
We have the fall. So let's make use of outdoor eating. Let's have picnics. Let's sit outside. Let's enjoy the fresh air, right?
But what if it's indoors, Dr. Rachel? And we got to wrap this up. What if it's indoors?
The thing is that you can't eat with your mask on, right? So you have to take your mask off.
Okay.
And then, I guess then how much can you enjoy? Can you quickly eat like within 15 minutes?
Okay. Is there an amount of time that we want to, if we're indoors at a restaurant with people, that we want to go, okay, it's 30 minutes, we're out of here because we were indoors?
Well, the CDC says that if you're exposed to someone with COVID within 15 minutes, and now they've said it's 15 minutes cumulative, so it's not even just at a long stretch, that indicates exposure. So if I was anybody, I would just say, don't eat indoors for a while.
Okay. All right. Thank you. A round of applause to you wonderful, awesome, phenomenal medical health doctors. What you're doing today, giving your time freely to everyone. I know you all are out there busy. I am so honored to have had you here and for all the wisdom and experience that you've imparted to everyone. My heart is truly, truly grateful. I really appreciate it. And I thank you for your time and for everything that you've given today. And with that, I'm going to turn it over to Harmony, and we're going to ask that she makes her housekeeping announcements, and we bring on the wellness team right now. Thank you to all my doctors. Yay, love, love, love.